Adam Vraves serves as the Vice President of Strategic Growth at Bon Secours Mercy Health, one of the largest health systems in the U.S. In his tenure at Bon Secours, Adam has been instrumental in expanding their urgent care footprint to nearly 70 locations. Adam champions the belief that urgent care is at the intersection of retail and healthcare and continues to push the industry forward. Welcome to DX, the podcast, Adam.
Thanks so much for having me. It's great to be here.
Yes. So what I admire about you and your team is that you're unafraid to experiment when it comes to urgent care operations. Tell me about how you're able to pressure test strategies, navigate business experiments within an environment that's typically rigid, right? These large hospital systems, how do we move things and influence quickly?
No, that's a great question. We definitely aren't known for our nimbleness as a large health system with 60,000 employees, multiple states. What I say, it always starts with the why. So doing a really good job communicating why you want to innovate, why you want to do things a little bit differently than the health system may have done before.
Right.
Next, become really good friends with the compliance and legal teams.
There you go.
But not in a way where you have these rigid train tracks that you really have to just follow A, B, C, D in an exact line, but some nice wide guardrails that allow you some space to try new things. And so from there, it's then just aligning incentives with the rest of the organization.
Yeah.
You have your overall why. Maybe it's around access, just bringing your care to larger and more diverse communities, but making sure that aligns with the rest of the health system that you're a part of. And
right.
Once you get those incentives aligned, things usually go in the right direction.
Awesome.
Yeah.
So tell me, if you're willing to divulge, any pilots or processes or specific kind of, detailed areas that you've thought about this retail and healthcare intersection, and maybe some areas that you've been experimenting or pressure cooking or all those sort of things.
Definitely. I mean, marketing's a big one. Even sometimes just using the word customer and the word patient.
That is let me tell you for a second, that is a big deal.
Yeah.
As providers, physicians specifically, we are, we spend all of this training and education around constantly and only ever using the word patient.
Yeah.
So entering into our first job or maybe our 15th job, it is still a very significant mental shift to pivot to customer, client, whatever words you want to use. So yeah, tell me more about that.
Absolutely. And we think that in healthcare, they definitely are patients, but our patients are our customers.
Right.
And we have a lot to learn from the big retailers and all the other industries we're out there engaging with as consumers, from the grocery stores to online retailers. And I think we have a lot to learn from there around reducing friction, but also maintaining really high quality. That's one of the big differentiators. So at Bon Secours Mercy Health, we really focus on three main things with our urgent care practice. Number one, be easy. So any technology or service or partner that can make it easier for customers to come in and get our care, we're all for it. Those are the things that we pilot quite a bit. We also want to be very welcoming. It seems like table stakes, but be nice.
It's hard some days, right?
We don't necessarily have that welcome in tagline that you see at every retailer out there now. But a smile and acknowledgement that someone is probably in need of some empathy and some care is really, really important. And then lastly, and this is for many organizations, but particularly for a big health system, be connected. We don't want this to be just a one and done and you're gone. We want to build brand equity and make sure that we can be your healthcare partner for all of your services and for your whole life. So finding technology that helps us be easier for consumers, be more welcoming, which is a bit more of a human thing, but more face-to-face time. So innovate in some empathy and also connect them on to the next part of their healthcare journey is really important for us.
I mean, it's huge because we're all people that are kind of going through these paths on our own as well. Outside of the work that we do, we're all patients. We all would want all of those things.
Absolutely.
So having that be at the forefront of what your guiding light is, I think is really refreshing, and it really does put the patient first, which is incredible. So. You see the patient journey in this, I would say, somewhat evolved way. We're at this kind of new idea space for healthcare, which is that it is a retail space. And I think we both share that common belief that urgent care specifically is at this very significant intersection of retail and healthcare. So I think we have to all ask the question, is it so wrong to think that urgent care could be like one of the best retail spaces or retail experiences that a patient can have? So tell me a little bit more about what that looks like for the patient, or maybe even for the staff that are now in this new realm of retail space, et cetera. So let's kind of dive into that.
Absolutely. And I think we'll take it from both perspectives.
Yeah.
From the customer perspective, some of my personally favorite experiences in consuming services is when the technology just kind of fades into the background and it feels so easy.
Yeah.
And I think the same thing goes for the service providers. And we in urgent care, we really think that our product is a service.
Yeah.
And our service is made out of people, and those are the providers.
That's great.
Best way to a high NPS and a 5-star Google review is have a happy provider.
Yeah.
Right? Because that's going to translate to
that whole experience.
Yes, to the patient themselves. So we spend a lot of time focused on making sure that we have providers that that are comfortable using the technology and that is seamless for them.
Yeah. That
we have great partners such as Xperity that provide a product that makes it easy for them to do their job and spend most of their time with the patient and let that technology kind of fade into the background in that perfect place.
I love that perspective because I think as we pivot into more and more AI opportunities in the healthcare realm in general, just let it fade away, right? Get those computer screens out of the way between patient and provider. Get those clicks on the keyboard out of the way. If we can just speak and have a conversation and it's captured, right, with ambient listening and scribes that are able to do that work, I think it's really going to elevate the patient experience overall. And that's such a great perspective to just let it fade away.
Completely agree. And we say a little thing sometimes when because we also like to keep it simple, functional, not fancy. Yeah. Right? So if it works, it kind of fades away. It doesn't need to be some super robust workflow with 100 steps that does something super complicated. But if it does the basics really, really well, it's magic.
Yeah. Let them have that uninterrupted experience where they feel the focus and attention is on them and their healthcare.
Absolutely. Well said.
That's great. So you've talked a lot in the past about explore versus exploit. So what tips do you maybe have for urgent care leaders today as they're setting their sights on maybe building a disruptive business and kind of looking for next steps of explore versus exploit?
Yeah, definitely. And this is a relatively new structured concept for me that I've just been thinking about a lot the last couple years. You know, I think we've all thought about when do you innovate versus focus on what's going on. But it's a concept started by this Stanford lecturer named James March back in the 1990s that really brought it into like organizational behavior. And the concept being you explore. A good example is you go to a new restaurant. Exploit, you go to your favorite restaurant. So you know what you're going to get. So the pros of exploring is you get more information that you can then apply to how you run your business, and you might have better long-term success, but you also might not have your eyes on the ball for what's right in front of you, what you could be doing for that day, that week, that month. Right. But when you do go to that new restaurant or you explore a new service within your urgent care, when you exploit and you go to that same restaurant that you've always gone to, you're really able to just dial in and optimize what you have. But the con of that situation is you may give up and miss the boat on the next big thing and be left behind. So we want to do both. Right. It's like you have to find this balance, right? Balance. And it's really hard for the same individual to do both. Yeah. And so finding opportunities for having individuals on your teams, or, you know, if you don't have as big of a team, you know, splitting up your weeks, your days, or doing sprints around, okay, this is my explore time. Yeah. This is where we're really going to focus on what's next, what can we add to the business. Yeah. But then you also have to have the individuals just doing your exploit time. Yeah. Make sure that you're doing best for your customer with what you're currently offering. Yeah. Really optimize every element of your business. Well, and that's a great perspective because it is nearly impossible to have your focus in two areas at once, right? And so the multitasking concept really does not exist, or it exists, but you can't really do both well. So you don't want to make a millimeter of progress on a million different things. Exactly. You don't get anywhere. You won't get anywhere. Yes. Yeah. Oh, well, that is a great thought for us to end on. So thank you for that. I really appreciate your time. Yeah, likewise. Enjoyed having you on DX the podcast, and would love to have you back again sometime soon. This is wonderful. Soon. Thank you so much for the time. Yep. Thanks. Yeah. DX the podcast was born out of the idea that we are ready to diagnose the future of urgent care with the smartest leaders in the industry. Find all the other episodes on Spotify and LinkedIn to keep up with us in this journey.